Have you recently injured your Achilles tendon and not sure the pain means you should rest or rehab the condition? Hey everyone, this is Dr. Zachary here, Performance Sport and Spine. In today's video, I'll be discussing Achilles tendon pain. We'll talk about what it is, how to manage the pain, and then the best way to rehab the condition. So what does this condition feel like? Well, it's very localized pain to the Achilles tendon, which is a large tendon that goes from your calf to your foot. 70% of the time it's in the middle portion of that tendon. About 15% of the time it's at where the tendon attaches to the bone. And then another 15% might be a mix of the two. And it usually happens after a big change in volume, either a spike or a dip. And it's often aggravated with such activities as walking, running, or jumping. And what you might find is as you warm up, the pain gets a little better, but if you push too hard, you pay for it that night or the next day. And then the pain is proportionate to the load. And more specifically, what I mean is if you do something that's twice as heavy or an exercise that's twice as fast, you can expect your pain to be double what it was at a lesser amount. And then lastly, there's pain or stiffness in the morning, and it usually gets better as you walk around. So who gets this? People that walk with a higher incidence in older people, distance runners and track athletes, and then lastly, multi-directional sports such as soccer, football, or basketball. And there are some other conditions that can present somewhat similar to Achilles tendon pain that we'll discuss later in the video. And then if you're concerned that there's something serious going on, you should always seek out the care of a trained healthcare provider. So the Achilles tendon is an energy storage tendon. And what I mean by that is it's more than just muscle attaching to bone. As you step down and your leg compresses, that spring kind of coils up and there's energy stored. And then as you lift your leg off the ground with walking or running, that energy is transferred to be more efficient. So again, it actually stores energy as you move, making your muscles do less. So now we'll talk about two ways to assess the function of the Achilles tendon and the whole calf complex. The standing single leg calf raise, with your foot on a step and your heel off it. So you raise your heel up 2 seconds to 3 and then down. For reference, look at this chart next to us. So if you're a male in your 30s, you should get about 33 reps if you're healthy. Or for females, you should get about 19 to 20 if you're in your 60s. You can compare your age group and gender to the chart. So some things to be aware of. Does the range of motion equal the other leg? Can the person raise their heels up as high and as low as the non-affected side? Secondly, does a person sway to compensate? So instead of raising themselves up with their calf, they just kind of lean forward. This is something to be aware of. And then lastly, do they roll over the lateral or outside of their foot? Again, if the calf can't do what it should, sometimes people compensate by rolling their body outwards, and this is something we need to be aware of. The single leg seated calf raise to assess the soleus strength. In a seated position with your toe on a bench and your heel off, place a weight or a bar on your knee, and then raise it up 8 times. Increase the weight until you hit your 8 rep max. For reference, we want to do 1.5 times our body weight for 8 reps. So this can assess how much strength you need to add. So now we'll discuss the exercise or rehab options. And the first thing to note is tendons really handle slow loads much better than fast loads. So we'll start with isometrics and then over time progress to plyometrics. In addition, later in the video we'll talk about load management. So often it's important to calm the tissue down before just adding these in. So make sure to check that out before you just start the rehab exercises. Again, the goal of rehab is to not only decrease pain, the red line, but to improve function, the blue line. So over time we need to strengthen the tendon so it can handle the loads and demands of life and exercising. So often a good place to start is an isometric, which just means that your joint is not moving and then progressing, but you don't necessarily have to start here. And the two options that are great are the soleus wall squat and then the single leg calf hold. So the soleus wall squat. Standing against the wall, squat down to place your back against the wall. Bend your knees to 45 degrees. Lift your heels slightly off the floor. Hold to 10 to 30 seconds depending on tolerance, and then do 5 to 10 reps. Your ratio of resting should be 1 to 1. So if you do the exercise for 10 seconds, rest 10 seconds between reps. Do this 1 time a day. The overall intensity should be about 5 to 7 and progressing over time. For the standing isometric, you're going to stand on a small ledge with a hand brace, lift your heel up, and again hold for the same duration and time as the previous exercise. And then to progress these exercises, we want to work up to 0.5 times our body weight of external load or weight. So you either can hold books or weight in your hands, progressing gradually, or you can put books in a backpack, whichever option works better for you. But again, the end goal is over time, and it should be 0.5 times your body weight. So isotonic. So the joints will be moving at a controlled rate. The first exercise is just the standing calf raise. So put your toes on a step and then raise up slowly and down. Do 3 to 4 sets of 8 to 12 reps, resting a ratio of 1 to 2. So if you do 1 minute of exercise, you should rest 2 minutes between sets. Progress to single leg, and then over time, add weight up to 0.5 times your body weight. The second exercise is a seated calf raise. So in a seated position with your foot on the steps and your heel off, raise your feet up. Again, start with double leg and progress to single leg. And the goal here is to go all the way up to 1 to 1.5 times your body weight, gradually. The overall intensity of these should be about 6 to 8 on that scale. So for maximal strength or more intensity, for the standing calf raise, place your toe on the steps with your heel off, holding about 0.5 times your body weight. You're going to perform 3 to 4 sets of 3 to 5 reps. But for this, when we raise our heel up, we're going to go as fast as possible to increase that intensity and that speed on that force velocity curve that we showed you earlier. Since these are more intense, you want to rest longer. So the rest ratio should be 1 to 3 or 1 to 4. So if you exercise for 1 minute, you should rest for 3 or 4 minutes. For the seated soleus raise, you're going to start with 1.5 times your body weight, and then again, increasing the same sets and dosage. Since these are more intense, you can be higher up on that scale, so if you're at a 7 to 9 out of 10 intensity, that's fine. And then lastly, plyometrics, so dynamically loading that tendon, which is great end-stage rehab. But we need to make sure that the tendon and muscles are prepared for this. So there are 2 important criteria that you need to be aware of. So you should have no or minimal pain, probably 1 out of 10 or less. And then lastly, those strength criteria that we talked about earlier, you should be 70 to 80% of those before performing these exercises. So week 1 to week 2, 1 time a week, you're going to do 2 sets of 10 to 20 double leg jumps, making sure to rest 2 minutes between sets. If all goes well on week 3, you're going to do 1 time a week, 2 sets of 10 to 12 reps of single leg jumps, again resting 2 minutes between sets. On week 4, 1 time a week, you'll do double leg, stiff knee, 2 sets of 10 to 20 reps, resting 2 minutes between sets. And by stiff knee, we mean don't let your knee bend as you land. For week 5, you'll do single leg hops forward and back. For week 6, you'll do side to side single leg hops. And then starting on week 8, you'll do single leg stiff knee hops with the same dosage applies as the previous exercises. So when rehabbing tendons, there's going to be some discomfort. It's unavoidable. So how do you know if you're doing too much or too little? Well, load tolerance just basically means, is the pain acceptable during the exercise? And more specifically, what I mean is if you look at this chart, from 0 is no pain and 10 is the worst pain imaginable, is the pain 0 to 5? Is it a 2? Is it a 4? Is it mild or moderate? That's probably okay. If it's a 7, that's probably too severe. And then the second part is, does the pain return to baseline after 24 hours? So again, some discomfort's normal, but a better indicator of too much is if you still feel sore 24 hours later, you did too much. If you're back to baseline, you're good to go. So this can kind of help assess whether you're pushing too hard, not enough, or just right. And then with all tendon pain or tendinopathy issues, the first rule of thumb is to get the pain to calm down. And the best way to do that is with load management. What this means is reducing or restricting the provocative activities that are irritating the tendon temporarily. So some good rules of thumb is decrease those activities by 50%, really try to minimize walking around with bare feet, avoid any stretching of the foot or the Achilles tendon, and then you need to establish a baseline. So use some sort of step counter to figure out how far you can go without flaring it up so you can objectively progress rather than just kind of guessing and then having a more ad hoc approach. And again, with tendons, often pain doesn't equal damage. Now, often if you have a complete rupture or a very large partial rupture, this doesn't hold true. But often there's just some discomfort with that, and you need to make sure that the tendon is very strong and you're not causing further damage with some discomfort. So these other diagnoses that can present somewhat similar to Achilles tendinopathy or tendon pain are the paratendon, which is this outside structure along the tendon. This typically has pain on both sides of it, and it's not proportional to load. You may have a full or partial rupture, but again, there's usually acute trauma. The Thompson test by squeezing the calf can be positive, and this can be further diagnosed with ultrasound. The sural nerve can mimic it somewhat, but often this pain is diffuse lateral Achilles and heel pain, and the quality of pain is often burny. And there's a small muscle called the plantaris muscle, but this pain is often only on the medial side, and the plant tears can compress the tendon. And again, this can be further diagnosed with ultrasound. And then lastly, there's some soleus issues. And this is often seen as a smaller soleus muscle. And it's usually worse with activity, but it calms down much more quickly. And again, ultrasound can further help diagnose this. And then with anyone dealing with tendon or tendinopathy issues, we highly recommend Peter Malaris' blog and website, which we will link in the description below. Thank you so much for our video on Achilles tendinopathy and tendon pain. We hope you found it helpful and gives you some ways to assess it, and then some evidence-based ways to rehab it on your own. If you did like the video, please like it and subscribe to our channel. And don't forget to watch our other videos.